Hello everyone, my name is Erilyn Dieng and I wrote my paper on aversive procedures and its side effects and how it's seen as controversial amongst the behavioral analysis society in our world today. Aversion therapy is a systematic use of stimuli or other treatment which a person is known to find painful or unpleasant for the purpose of discouraging undesirable behavior on part of the person. This type of behavior is supposed to be seen as a quick fix for treating certain behaviors like alcohol or substance abuse. Others seen it as a way of treating sexual deviance like homosexuality or even child molestation and pedophiles. Some procedures, like chemical-based procedures, use smelling salts, pills that make you nauseous or vomit, or drops that change the taste of certain drinks and some food. Normally the drinks are focused on alcoholic abuse, or for food it's for obesity. There's also aphoretic type procedures where it induces any physical pain like electric shock or spankings. There's also restraints where if you have serious injurious behaviors, they will bound your limbs and your body so that you're not able to perform these behaviors on yourselves. Also, there's food deprivation, which is also a focus on obesity, and timeouts. If any child were to have a tantrum or a freak out moment, they would use that and implement that as procedures for reducing any type of injurious behaviors. Next, we'll look at the history of aversive procedures. It actually started in the United Kingdom in 1247 in a hospital called St. Mary's of Bethlehem. They were known for their chaining and whipping and water punishments like spraying or dunking them into water. This was mainly focused on people who were in the psychiatric ward that they couldn't handle their behaviors. Even over time, they still use these procedures until about the mid-19th century when they were finally questioned on their methods of treating these psychiatric patients in their wards. Aversion therapy in the 1950s is when it became actually popular. Interventions for alcohol, drug abuse, sexual deviance like pedophiles and molestation, and even obesity were the type of behaviors that was focused on for aversion therapy. Researchers believe that it was the most quickest and the most efficient way of handling these behaviors and suppressing any negative behaviors that needed to be fixed. There are many ways of treating substance abuse, 12-step programs, even life coaches. However, aversion therapy is the most effective one that treated any type of alcoholic or drug abuse. A study by Howard compared different studies from the past on the usage of chemical aversives like taste-changing drops and pills that made you vomit or nauseous on alcohol consumption. They looked at whether or not people were able to increase their confidence on not the dependency on alcohol. And the study found that it was most effective, especially when the participants were able to step out into a setting that involved alcohol, like parties and the bar, and they were able to not have a drink or at least have one drink 6 months after the study. Another study was done by Smith and Frawley that looked at 600 participants that used both non-aversive and aversive treatments. From the results, it showed that both procedures, when utilizing both procedures in the extensive program, from going back and forth to non-aversive to aversive, it was most effective in treating all types of substance abuse like marijuana, cocaine, drugs, other drugs like, or in alcohol, I'm sorry. So this study proved that not just the usage of one procedure, both procedures of aversive and non-aversive were much effective in decreasing substance abuse. Another type of behavior that needed to be changed was with aversive procedures was sexual offenders, particularly child molesters. Quincy wanted to focus on different ways to see reduction of the need for child molestation by the use of aversion procedures. So he basically wanted for child molesters to not just suppress their thoughts and wants to molest a child. What they wanted the procedures is to be a reminder to use those what the conditions are if they were to think of even touching a child. Marshall and Barnaby also looked at outpatient facilities that would be beneficial in child molesters when using averse procedures. However, the one main problem with their study was the fact that no one was really open about being a child molester, so their results were very minimal, but yet their treatment was very successful amongst the small amount of participants that they had in their study and in their facility. Another behavior that needed to be changed that was actually successful with aversion therapy was homosexuality. They had seen homosexuality in the 1930s as an unjust and immoral type of living that needed to be changed. So different types of therapy were used, but most importantly, aversion therapy was used, like vomiting-inducing pills were used, along with any nauseous vomiting pills as well. A study by Bancroft and Marks looked at male patients who were homosexuals, transvestites, and transsexuals. They were shown pictures of what they were liked and what they should like, and they were shocked. They were used electric shock to when they were aroused by homosexual or anything that involves transvestites, and were rewarded if they liked anything that was heterosexual. There are many controversial issues about aversion therapy. The one main concern is that it could cause physical damage towards the person, especially if the person cannot vouch for themselves. The one main concern is that they don't want people with medical disabilities to be treated in this way. It's more so treat others the way that you want to be treated. And the question is, would you want to be treated with shock therapy because you can't sit and control some behaviors, especially with people who have any mental disabilities, like anyone on the autism spectrum disorder or anybody who has Down syndrome. Those people really can't talk for themselves or speak for themselves, especially if they are low functioning. So the one main concern that everybody had over the years was the fact that they couldn't speak or think for themselves, and they don't know when to stop when it comes to pain and say, hey, I'm in pain. One of the biggest groups that helped with banning any type of aversive procedure was TASH and AMD, and they mainly focus on what Bailey and Birch says is to do not harm, and as behavioral therapists and analysis, we shouldn't harm our clients, and we should always give our utmost care and respect. The one main side effect that no one thinks about when it comes to aversion therapy is what could happen in the future. Yes, you may be fixing some behaviors like trying to decrease alcohol consumption or substance abuse, but what happens when it comes to children who are mentally disabled or any person who's mentally disabled? They only are thinking about the cure, about curing the here and now, and they don't think about the future and the possibilities of and the repercussions that could occur. There was one study done by Butler that looked at 100 cases of children who had used aversive therapy and procedures to cure certain behaviors like self-injurious behaviors, and the results of how they felt, they found that they were traumatized and they were hurt and they were secluded and restrained because of the aversion procedures, and the parents saw a difference amongst their children because of those procedures. One famous procedure that was done when it came to the future repercussions of aversive procedures was the Sissy Boy experiment done by Reckers and Lovaas in 1974. What the parents felt was that their son was becoming more and more feminine every day, and they wanted to cure it before anything would happen to him in a school setting. So two procedures were done, one where the mom was to sit in in a room where there was two tables full of toys, one with boy toys and one with girl toys. So the mom was supposed to give attention to her son when he was appropriately playing with the boy toys, and if he was playing with the girl toys, she was not to give him any attention whatsoever. The most attention she would give would if she were to give for the boys toys, if he was playing with the boy toys, was that she would say, "Oh, you are playing with boys' toys. That's so appropriate. You're a boy. You're playing with boy toys." So it got to the point where the son was getting very upset because all of the attention wasn't given to him when he was playing with the girls' toys, to the point where he was crying and had to be taken out of the study. But the study still continued. So they did another procedure at home that was a token cost response system, where he was given blue or red chips. Now the blue chips were for doing a good job in playing with boy situations and playing with boy toys, whereas if he was seen doing any feminine type stuff, he was given a red token. And the amount of red tokens he would actually get aversive procedures, so he would be physically hurt. He would get hit and spankings and any kind of punishment from the father, and this program lasted about 1 year. It was successful, that the authors were true, that it was successful, and he was able to play with boys' toys and ignored anything that was feminine. He did everything masculine. However, there was huge side effects that resulted in him becoming recluse and withdrawn, and the family had noticed that he wasn't the same person anymore because of the horrible abuse, which the researchers said it was okay. And over the years, he did masculine things and was in the Air Force for 8 years, but then after that it resulted in his suicide. So my stance on aversive procedures, the one thing that I would say is, for certain types of behaviors, yes. For sexual deviants especially, child molesters, rapists, and pedophiles, I believe that with how effective aversive procedures are for these behaviors that are learned, it should be utilized, and it should be used for these types of behaviors. When it comes to homosexuality, however, I don't think that aversive procedures should be used, because homosexuality isn't just some behavior that's been picked up. It's within them. So any type of behavior that isn't learned, I believe shouldn't be used by aversive procedures, like homosexuality or serious injurious behaviors, mostly because serious injurious behaviors are somewhat attention-based. When it comes to alcohol and drug abuse, yes, I believe that aversive procedures should be used on that as well. The one thing that I have come across during my time of being a therapist with autistic children is the fact that when it comes to serious injurious behavior, it's hard to handle, especially when there's certain stimming and stereotypy that one can't control, especially when us therapists aren't there every day, especially if it's home-based therapy. And the one thing that has actually helped myself a lot was the use of a wooden chair for one of my clients, who would flop and tantrum and basically throw himself backwards to the point where he would almost hit the ground, where he would actually hit the ground and hurt himself, and he would bang his head, pull his hair, all those types of behaviors. And the one thing that really helped us out was the use of a chair that, what I call, when we say, as loose restraints, which is, there was a detachable tray on the high chair that could come on and off, and that was where we would do materials, anything that was receptive or anything that was card based that he would have to match, we would put the tray on there. But that also helped him keep him in his place so that he wouldn't hunch over, he wouldn't bang his head, because it was pretty tall. So that chair actually helped reduce a lot of his behaviors, and his tantrums did go away, and he's actually happy that he has his own special chair. So with something like that, I think that minimum or small amounts of aversive procedures like loose restraints should be used, especially when it comes to behaviors that one can't handle. It also depends on how you should look at the situation. Always look at ABCs, and that's what I always do for my work when it comes to any type of behavior that needs to be focused on and fixed.